lungs and the muscles around the lungs have bronchial spasm, which means there's some type of irritation, whether it be inhalant, something as simple as a perfume or an allergen floating around in the environment, or dust mites or whatever it might be, triggers the lungs to get tight, the muscles around the bronchial tubes. And those people have trouble breathing. And that's a sudden event. It can happen with cold air, it can happen with any stimulant that person has to be aware of. And that's why you need something fast acting to help relax those muscles around the bronchial tubes so they can get air in. Some asthmatics will talk to you and they'll describe asthma as being underwater trying to breathe through a straw. And you can see how frustrating and worrisome that is. So that's why you need a rescue inhaler in those situations to relax the lungs out. 40% of people with good old seasonal allergies will have some asthma component. So it doesn't mean everybody have asthma, everybody who has allergies have asthma, but there is a cross section. They have to be aware of it because those are the people that would have maybe a sudden event where they need to be, like an athlete, people that are around smoke, you know, where they're not around it very often, but boy, they expose, they can get tight. So that's why they have to be aware of it. Well, asthma by definition is COPD, which is chronic obstructive pulmonary disease, but it's reversible. So it's not like an emphysema or pulmonary fibrosis where it's permanent. So you do have to learn the triggers. What triggers that sudden event? And so they have to be very aware of that. And they stay away from people with smoke, or they stay away from certain perfumes or things that would trigger it. Allergies by themselves, extremely common. In fact, if you back up, 80% of us take something for this tickle postnasal drip. And we think that to be allergies, but a lot of people are tested and frequently they come up with no allergies. So unfortunately, that could be just air quality. Our homes are so tight, they don't breathe very well. Our big buildings don't circulate very well. That doesn't mean they don't have seasonal increased congestion, such as in the spring and the fall. And those people need to layer different allergy medicines, whether it be a nasal spray, steroid spray, or a Claritin or an antihistamine like Allegra or Zyrtec on top of that.